your aortic arch and your descending aorta. Here's your brachiocephalic artery and your left subclavian, because that's how it works on a cat. And then we come up here and we can see the brachiocephalic branching. So we have the the right subclavian there, the right carotid and the left carotid. Then we're going to follow the left carotid. And, oh, that's good. You still have your superior thyroid artery here, going to the thyroid gland. And you have your muscularis artery here. We'll pull the digastric muscle back. Got a big lingual artery here. Just that real short piece right there is your external carotid, and that should branch. Okay, so we did have a bust right there. Got one? I think it went over here. Yes? So it broke?
Oh, yeah.
That was connected to that. So that would be, well, this is the parotid gland, so that little thing right there is the parotid artery, correct? Okay, then your whopper size one, look at the size of that thing. That's the internal maxillary, and then the external maxillary. Your external maxillary, external maxillary is this bigger one. I don't know that one.
You had said last time that was weird that it had an extra.
Did I say that?
Yeah.
So I don't
Where's
know.
the laryngeal?
Okay, so you still have it.
Oh, good. It's covered. That's
Yes, it's got connective tissue.
all right. So I got those two.
You do have it.
Laryngeal.
Yeah, you still have it. Okay, then, I don't know if you'll be able to see this view, 'cause I can't even see it, but I see a labial coming right here.
Oh, okay.
Yeah, you can see it.
But I don't know, let me push this back. About
Oh, yeah.
submental. Oh, you got a good view there?
Yep.
Submental?
So this one is the submental.
The one going up. Yep.
Yeah.
Yeah, you got a good one.
Submental.
That's the one I couldn't find nowhere.
I knew
it was
well, your
under.
digastric was hiding it. See, look. See, that's digastric. So when we bisected it and then reflect it, you can find stuff. Okay. So when you put digastric back down, you don't see much of anything, really. Yeah. Okay, so that was up the carotid. Just to make sure you guys know, you know all the parts of the mouth.
Incisors,
Incisors,
molar. You have your
canines, molars, hard palate, way back to your soft palate. You guys have tongue, lingual frenulum. It's okay?
Can we do premolars, first molars, and second molars, or do you want them?
Molars, I don't care about that.
Okay.
Are any of you going into dentistry?
No.
Me either. Okay, so trachea, larynx. We already mentioned parotid gland. And what did you guys do with your submandibular? Here it is. Submandibular gland.
My nose is running.
Now, I was telling you in lecture the other day, to find sublingual, we'd have to take all this musculature out. So I don't want to do that. So we did find the submandibular and the parotid, and those are two salivary glands. Oh, another nice view of the esophagus here. And it does. And we already mentioned the thyroid gland. It's a good view of that. A good thyroid gland. Okay, over here we have the left subclavian. And then this is your internal mammary, and I'm going to pull on it. And then we see your VCT, vertebral, costocervical, thyrocervical. And then pretty much as soon as you can see, I've got the rib cage here. So that really is the end of the subclavian and the beginning of the axillary. Because now I'm in my cat's armpit. And then we need...
Oh, we were right. Or
you like
Monday.
being right?
Is that one that's subscapulary?
Well, let's slip. It's got to go down. A little bit of time right here.
Yeah, better be right there.
Yeah. Just go that way.
Got gloves on.
Okay, Casey, come look from this view.
See, that's what I was saying.
It's because it's big on this cat. Subscapular artery. Okay.
It sure is big.
Yeah. So really from about here to there is going to be the axillary artery. And then from here to the elbow is going to be the brachial. Correct?
Correct.
I'll get all this out of the way. Okay, then a minute ago I was just doing a little bit of time down here because your cat has really nice radial and ulnar arteries. Radial would be this one, of course ulnar would be this one branching off of it. It's okay? While we're up here, let's talk veins because your cat's really good on veins.
Good.
Your cat has an external jugular here. Your cat also has an internal jugular. It usually doesn't fill with latex well for the other cats, so that's why it's not on our list. But your cat has that.
Oh,
It's called the internal jugular, external jugular.
Don't we have one jugular?
Yeah, external.
Right, okay.
And then this is your cat's subclavian vein. So you can see the jugular veins and the subclavian veins combine to form the brachiocephalic vein. Brachiocephalic vein and brachiocephalic vein combine to form the superior vena cava. And then we need something for a sternal here. There it is. Up there. Hey Chris, is your cat the one with the sternal vein that's still attached to the sternal the wall, the chest wall? Okay. Yeah. So if you look at Chris's cat and Paulina's cat, their sternal vein will still be attached right there.
Okay, cool.
But when we open it up, it broke. That's okay? All right. You guys know all the parts of the heart. And so your the veins coming out of your lungs aren't great. I think it was that cat over there store that had the
that's the
pink
good
ones. Yeah. Let's see what your azygous vein looks like. Oh yeah, you
Looks
got a
pretty
good
good.
one. Yeah, a good azygous vein. Can you see that, Casey, right there?
Yeah.
So it comes up the right side. Right side.
Just right side.
And then most of the time then we roll to the left because the left gives us that really great view of the aorta and the esophagus.
Oh, yeah.
Yeah. So most of the time we spend with this view. And you can see the aorta coming down. There's the esophagus. All right, the little arteries that are coming off of the aorta to do the ribs are called intercostals. And then the little arteries that are coming off to go to the esophagus are called esophageals.
And you said you could taste us with the aorta up here or further
Oh
down.
man, all the way down. Look how far down. The aorta goes all the way to there.
Okay,
It starts there, goes all the way down.
No, you already did, okay.
Yes? You guys know what a lung is?
Right.
Diaphragm,
Diaphragm,
So the
liver. Don't miss the easy stuff, right? What's that?
gallbladder,
Gallbladder. What's this?
greater omentum.
Okay. This is top part of the stomach right here.
Oh,
Fundus. What's that?
that
That's
is the lesser omentum on the
Yeah.
lesser
And the-
curvature.
yeah.
Okay, what's this?
Greater curvature.
Okay, what are these?
Rogies.
Okay. What region of the stomach is this?
Oh, okay. The top's the fundus, the bottom is the
Pylorus.
pylorus.
Good, and you can see it constrict. There would be a sphincter there. See it constrict right there? So that's the end of the stomach. So what would this be?
That is the duodenum.
Duodenum.
I thought the duodenum was.
No, that's the
Well, the duodenum starts right
Oh,
here.
okay, yeah, that's what I'm saying. Duodenum, then duodenum.
Yeah, so starts right there, ends about right there.
Okay.
Okay? And then what's this right here?
pancreas.
Pancreas. That's good. Okay, so, oh, what's this?
Spleen.
I don't know what that. Oh, our spleen struck a break.
Oh, that's
Come
lovely.
on, don't let us down, cats. Stay together. Okay. This artery,
Celiac?
celiac. Okay, did you guys find the hepatic? Yeah, you did. Look. Hepatic artery.
Hepatic. Oh,
See, I had to reach in there and
Right,
grab it.
yeah.
It's because it's underneath there. It's hiding. And then there's a lot of stuff there.
Yeah.
So, hepatic. How about this one?
Gastric.
Gastric. How about that one?
Splenic.
Splenic. That's good. What's this little bean? Adrenal gland. Okay. Ladies, we actually could do a little more cleanup here.
To get
Because
to
you
the-
found everything, so now you know that you can kind of break some of this connective tissue. See, look how much better that looks. What is that big artery right there?
Superior mesenteric.
Superior mesenteric. Okay, then the superior mesenteric branches to make all of these.
Those are the
Intestinals.
intestinals.
What do you call this clear stuff?
Mesentery.
Mesenteric. That's good. Okay, got another artery right here.
That's the inferior mesenteric.
That's very good. Inferior mesenteric. I don't know if you heard her. Okay, and then it's a little weak, but I got an artery right there. It is weak, I agree. Running all the way up the colon.
Oh.
Oh.
Dang it, where's my list? I can't
It's
remember.
running up the colon.
Is it the colic?
It's the colic.
Okay.
And we just went over that one.
I busted that vein, sorry, but maybe you can see the colic a little bit better with that vein out of the way. The pink line. But it is a little weak. This one's not bad down here. One that's going down. What's that one called?
Hemorrhoidal.
Superior
Superior
hemorrhoid.
hemorrhoidal.
That pink one right there. Okay, so as Casey said, this is the inferior mesenteric, and then it's going to go up and make the colic, and go down and make the superior hemorrhoidal. Okay, oh, this is a good one right here. What's this?
Adrenal lumbar.
Adrenal lumbar. But that's the artery. This is the adrenal lumbar
Vein.
Is that the
vein.
phrenic? Right there.
Yes.
Okay.
And how would you know? Where's it go?
It's going up
To the diaphragm?
Yes. Going to the diaphragm.
I'm looking through my phone right now, so I can't really.
Okay. Ellen's handling it. Casey's handling it for us. Okay, I'm just cleaning up a little here because, like Harley said a minute ago, we have to know the aorta all the way down the body. So I'm just making sure you guys can see that's still the aorta. Just following the aorta right there. Okay, coming off the aorta right here,
Renal.
renal
Artery.
artery, and then the renal
Renal
vein.
vein.
And what would the renal vein drain into?
Inferior.
Vena cava.
That's correct, the inferior vena cava, just right there. Correct?
It's huge.
It's huge. Okay. So everybody knows what this is. What is it?
Kidney.
Kidney.
Okay. Like this.
The capsule.
Capsule. Now we're going to need renal capsule.
Renal capsule.
Renal capsule. Okay, how about now?
Cerebral cortex.
Renal cortex.
Medulla.
Renal medulla.
Renal medulla. Renal.
Pelvis.
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 Good on the kidney? Okay. Oh, one more.
Ureter.
Ureter. Okay. So we had a male. Just saw this laying here, so I figure, well, might as well do something with that. What's this?
This test.
Testy. Okay, and then the testy has this thing,
Epididymis.
epididymis. Yeah, could almost make it through. Let me see if I can.
I think we did the other one. Hold on. That's already done.
Use right there.
Testing.
Yep. Now this one still has a covering on it. This one doesn't. What's the name of the covering?
I
don't remember this. No, I have it somewhere.
Tunica
Album.
albuginea.
Janea.
Are you filming me playing with this testing? Sure. Yeah.
Ivan.
Yeah. So I just want to make sure you guys can see it's two separate things. That's why I put my probe all the way through. So this is the testy, and then there's the epididymis. Okay, 5 parts of the spermatic cord. What are they?
Oh,
Vas deferens. The autonomic nerve.
A nerve, yeah.
There's an artery
Artery,
and lymph
lymphatic vessel, yeah.
and a vein.
And a vein. You guys okay with that? Mm-hmm. 5 parts of spermatic cord. So look how cool your cat is, because so this came through his abdominal wall, kind of like that. And then you're so good, you still have his testicular artery intact. You really still have his testicular vein intact too. It just didn't get any latex in it. See that
Yeah,
tissue
yeah.
right there? Yeah. And then you still have your vas deferens intact. Right there. So that's really good. Yeah, but didn't you guys do this dissection, the male dissection?
Yeah.
Yeah, you came in early?
Yeah.
Quick question. What is this tissue right here?
Mesocolon.
Mesocolon. That's good. Oh, you still have lymph nodes in it too. Super cool. What organ is this?
urinary bladder.
Urinary bladder.
So we have to call it urinary bladder?
Yeah, because we also have a.
Oh, gallbladder. Yeah.
Okay, so what's this tube right here? Urethra. That's good. And did your guy have a little
Yeah,
hard
he does.
spot?
He has a
Yeah.
little one.
You can feel it.
Yeah, but you're right. It's not much.
It's not. They had the better one behind.
And then
us.
what are we feeling?
Prostate. gland.
Prostate gland. Okay, what's the name of this?
Oh, are you talking about the covering or the penis itself?
Penis.
Yeah. So you're just gonna write penis.
Okay.
What are you gonna write?
Penis.
Grant.
Shaft.
Shaft.
Of penis.
Oh, shaft of penis. Okay. Shaft.
And then if I pin here,
Glands.
glands.
Of the penis.
Penis. Yeah, glands of penis.
Shaft of penis. Glands of penis.
Don't get your penal parts messed up.
Yeah, let's not call them balls.
No, oh, she's recording it. Okay, what do you call this sac that the testicles were removed from?
Scrotum.
Scrotum. And what do you call the skin that we pulled back from the penis? That's what your patients call it. What are you going to call it?
Oh shoot, I don't remember. Gland, shaft, prostate, area.
Prepuce.
Prepuce. Prepuce. It's the foreskin. Prepuce is foreskin.
All right. So back here. Everybody told me that was inferior vena cava. What's that?
Abdominal aorta.
And then what's this one?
Iliac.
So the iliolumbar?
Iliolumbar.
Yeah.
And here it is on the other side. See it? Okay, how about this one?
Sternal iliac.
External iliac, good.
Internal iliac.
Internal iliac, and just dissect it out really well, ladies.
Caudal.
Caudal. See, once you dig in there, it starts getting loose and it's easier to see stuff. You may remember your first day it was in there so tight.
Yeah.
So now it's easy to see that. Yeah. Okay, so then the external iliac goes into the leg. So now we call it the femoral. And what about this one? Deep femoral. And then I'm going to pull and it disappears. There's a nice view. Look how big it is, Harley. See that? What is that? Goes into the back of the knee.
Popliteal.
Popliteal, yeah. And then not so much stays out here, but what is that? Saphenous. And so, of course, we have artery and vein. So if I put the pin in the blue, write saphenous V or vein. If I put the artery in the pink, the pin in the pink, then write saphenous artery. Okay, let's flip your cat. What muscle are we going to pull apart to see the tibials?
Oh Lord.
Oh, Lord. What's the name of this muscle? that I just pulled apart.
Jesus in heaven. It starts with an
No, it does not.
E. Okay, gastric.
Gastrocnemius.
Gastric.
You did better than me. I'm thinking the little hot dog on the front end of the leg.
Are you kidding me?
Because I was like, wait, there's another hot dog here.
It's okay. We just have these two left. What's the name of that? That just
The
cut?
nerve.
Yeah, the nerve.
The sciatic.
Sciatic nerve. You guys are killing me. You're killing me. I teach you more stuff and you delete what we already had. Can't do that.
I know.
Casey, you can't do that.
We trying to keep space for the arteries.
You made space for the artery.
That's like you asked me where the bones are. I'm like, dude, be there.
Jeez, don't tell her that.
I get that. You know how you have to create space. I do.
Well,
Your guy had a chubby knee.
yeah.
I'm just gonna pull it away.
He was a fat house cat.
Good for him.
He had a mice in his stomach. I don't think it was a high stuff.
Might be. They might have had a lot of mice. You know?
Like a barn cat, maybe?
Yeah.
Where he got fed and he got fed, so to speak.
They had a lot of
Mexico.
exercise.
There's a lot of mice in. You know,
He
in
laid
Mexico.
around. Mm-hmm.
What did you say that nerve was?
Sciatic.
Sciatic.
Okay, the reason I'm just digging here is, see, your popliteal comes out really nice, vein and artery. And then your anterior tibial is the one that's going down. And then I'm holding the posterior tibial. Just picking some of the fat off of it. Okay.
I'm having to Snapchat this.
What?
Oh yes, because I guess I used up all my
You
video
got
in
it,
20
right?
minutes.
I got everything.
Okay, good.
It only allowed me
That's
to
why
do
I
20
didn't want to do it
minutes.
because I was scared I wasn't going to have enough.
Pretty good.
Okay.